Harsh and severe winters of Delhi continue. Some people torment it, some people enjoy, but one thing is common to all. Urination ज़्यादा होता है, polyuria. But today we are going to talk about two conditions in which excessive urination, polyuria is there, diabetes mellitus and diabetes insipidus. Why there is polyuria in these two conditions, we are going to see. First, diabetes insipidus. The defective antidiuretic hormone released from the posterior pituitary. It's a hypothalamic hormone, nonapeptide released from the posterior pituitary, and it causes reabsorption of water from the renal tubules, precisely distal convoluted tubules and collecting ducts. So it causes reabsorption of water from the collecting tubules. So if ADH is less, if it is deficient, or if it is ineffective because of some receptor defect, in both the cases, its action on the renal tubules will be hampered. In other words, reabsorption of water from the tubules will be hampered, will slow down. As a result, the unabsorbed water will be eliminated in the urine. So more water eliminated in the urine, I repeat, because of decreased reabsorption from the renal tubules. And the result, of course, will be polyuria. Dilute urine will be secreted out. What about diabetes mellitus? A bit complex compared to diabetes insipidus. In diabetes mellitus, insulin, either deficient production or receptor defect, as happens in any hormonal defect. So insulin is ineffective. The result of that will be hyperglycemia. Blood glucose level will rise. So more glucose will be filtered at the glomerular level. Normally, jitna bhi glucose in a normal healthy individual, whatever glucose is filtered at the glomerular level is reabsorbed in the renal tubules. The renal tubules, they have got a high reserve capacity to reabsorb glucose, 320 milligram per minute. That's an enormous amount. But supposing if there is severe hyperglycemia, blood glucose goes beyond 180, we are going to discuss. So if there is severe hyperglycemia, then more glucose is filtered at the glomerular level than can be reabsorbed at the tubular level. So the filtration exceeds reabsorption, and the surplus glucose will be eliminated in the urine. So you people know the last step of the story, that glucose is osmotically active substance. Whenever it is eliminated in the urine, it carries water also along with it. So as a result, more water will be eliminated. So there will be polyuria. So 180 milligram percent we talked about, that is called renal threshold for glucose. If glucose level goes beyond that, then only it exceeds tubular reabsorptive capacity and glucosuria will be there. Now, one or two questions for you. What is renal diabetes? Okay, tell the answer. Yahan par the renal threshold is lower down. So at the 160, 170 also, the glucose will be eliminated in the urine. Now, one or two question. Is this condition fatal? Does it lead to renal failure? Number two, why such patients are likely to suffer from dehydration? Third question, diabetes mellitus, diabetes insipidus, दोनों का यूरिन कंपेयर करो. Specific gravity of which urine will be higher, mellitus or insipidus?